This is a presentation on access to internet resources for the iReach program.
First, a quick acknowledgement that this project was supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services, and a disclaimer that the contents of this presentation and myself do not necessarily represent the official views of, nor an endorsement by, HRSA, HHS, the Department of Veterans Affairs, or the U.S. government. In this presentation about accessing internet resources, there are three main learning objectives. So hopefully by the time you have finished this presentation, you will first understand if you don't have ideal internet access, or your internet access is slow, or you don't have any at all. You'll first understand how you can gain or improve your internet access so you can make the most of these resources. And then second and third, you'll have a basic introduction into two of those resources, My Health EVet and VA mobile apps.
How to gain or improve internet access. So first, before you even start to try and use different internet resources that are available, it's important to consider whether or not, obviously, do you have internet access in the first place, but also is the quality of your internet sufficient for you to be able to use these resources. So one thing you can do in the context of the VA is ask a VA provider for a digital divide consult. And that will help you get connected with a VA social worker who can help guide you and help you determine whether or not you have the level of internet access that you might need if you wanted to pursue telehealth appointments, for example. Or even just, is your internet access at the level needed to use other resources that might be available? And additionally, a digital divide consult and social workers that you can get connected with, they can provide internet-connected devices too, like a tablet, if you don't have one already. Another thing that is worth looking at or considering is internet service discounts. And so one example of that is the Affordable Connectivity Program. And this can help pay for broadband services and internet-connected devices. So, for example, you can get discounts up to $30 per month for your internet service, and discounts up to $100 for a device that you might use to access the internet for these resources, which again is important because if you don't have a significant or appropriate internet, then internet capabilities, then the resources are not going to be as helpful. Another thing to consider is Lifeline. So if you're thinking about looking at phone services as a viable option, Lifeline can provide discounts on your phone or your internet bill. But if maybe even the internet that is available to you is limited because, let's say, you live in a rural area or something like that, you might consider using a phone and phone services with using data and looking for some kind of discounted data plans to access internet resources. One thing to note when considering whether or not to use phones and data plans for these types of resources, veterans who are trying to use VA Video Connect as the way to do telehealth appointments with the VA Video Connect is conducted without any data charges for veterans. So that's important to know for people who are trying to determine whether or not internet service or phone data plans are the best option for them. One important internet resource within the VA is My Health EVet. My Health EVet is an online portal that allows you to manage all of your VA healthcare in kind of one central location. So this has capabilities of managing your prescriptions, managing your appointments, even your healthcare records. It also allows you to communicate with your healthcare team, so you can send and receive messages from healthcare providers, physicians, whoever it is, to communicate about the healthcare that you're seeking and managing at the same time. And then additionally, there are resources that are available to get you connected with other services, or even resources that you might be able to use on your own. Lastly, another important internet resource is VA mobile apps. So these are apps that you can download onto your phone or your tablet or any personal device. It doesn't matter if it's Apple, Android, or Windows. Most of the apps work on all of those kind of devices. But there's a wide range of devices that are provided by the VA, and many of these are accessible to civilians, even if they're not veterans who are enrolled in VA healthcare. So there's a wide range of apps, covering things like managing your healthcare appointments, managing your VA appointments, connecting with your actual VA healthcare providers. But in addition to that, there are things like apps related to benefits, VA benefits, or even down there you can see there's library network apps. Importantly, some of the more popular apps are also things related to physical wellness and mental health. So there are several things that apps on there that you can download on your own and kind of use as a self-guided way to help make progress on physical or mental health goals that you might have. In total, the VA mobile apps has 36 different apps that are targeted for veterans, but there's also 48 apps for healthcare professionals and even 6 apps that are designed for family and caregivers. So even non-veteran or civilian targeted applications. So this is a good resource to look into if you're trying to find additional tools that you can download on your personal device and kind of explore on your own at your own pace. Thank you very much for listening to this presentation. Please feel free to check out all the other presentations and modules of the iReach program along with the fact sheets. There is one fact sheet linked with each presentation, which also includes additional resources and suggestions. Thank you again.